Okay, so far we've covered part one, which was the basic terminology and some of the gross anatomy of the brain. Part two, we talked about some of the lobes and the internal structures and the specific functions associated with them. Part three is really getting into some of the cranial nerves, and this is something that you're going to have to really focus on learning on your own, just mainly because the cheap brain dissections aren't really, you can't really see many of the nerves. You usually can get the first three, but anything after that, it's really difficult. So you really got to use some of the images that are provided in your textbook and your lab manual to get familiar with all 12 nerves. So like I said, there are 12 nerves, and they pretty much arise from different areas in the brain and then exit through foramina, right? So those holes in the skull, and then they lead to different muscles and glands and organs around the face and the body. So there's a mnemonic out there, and you can actually feel free to Google them because they get pretty dirty. But the one that you can figure out, find one that works for you. But again, you're going to have to spend some time getting familiar to get the 12 down pretty well. So we're going to start from the rostral end, or the anterior portion, and then work our way caudal or posterior. And they go olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, Glossopharyngeal, vagus, accessory, and hypoglossal. So the mnemonic that we use is, on occasion, our trusty truck acts funny, very good vehicle anyhow. And again, feel free to Google these because there's ones that are a little bit more memorable out there, but for this class, it's keeping it PG. So we're going to start with talking about each individual nerve, some of the specific functions associated with it, and if there's anything really particularly of interesting note, we'll mention that. So olfactory nerve, also called CN1 or cranial nerve 1, is, as you might guess, is dealing with olfaction or smell. And so some interesting things about this is that, you remember on the ethmoid when we were learning about that, there's that structure called the cribriform plate. And on that cribriform plate, there's actual cribriform foramina, which are those holes that pass through it. And so there's these fascicles, or kind of tendrils, that come off the olfactory nerve that pass through. And so this is actually the only nerve that's exposed to the external environment through your nose in the epithelial tissue. And some interesting facts about this is, or one, I guess, is in an accident, or what we call a coup contre coup accidents, where you are driving along, or you're running full steam into a wall, and you hit a wall, you come to a stop, so your brain sloshes forward, and then you have that kind of whiplash effect, and it slides back. And so what happens is, since these nerve endings pass through this bone, the brain slides over that olfactory bulb and can sever those nerves, the end of the nerve endings, those fascicles. And what the end result is that you can lose your sense of smell. So sometimes you hear during people in car accidents or afterwards, they lose their sense of smell, and sometimes they regain it, sometimes they don't, all depending on the extent of the damage associated. But it's because that brain is kind of sliding over the olfactory nerve, which has these parts that extend into the external environment. The next nerve, CN2, is the optic nerve, and this is going to be the one that is dealing with visual sensory information. And if you look at it, some of the structures to be aware of are, you have the kind of you have the optic nerve that runs, and then it crosses, and that X is called the optic chiasma. Chiasma is just kind of, in this context, just an X or a crossing, and what it allows is the left side, your left eye, to go to your right hemisphere, and your right eye to go to your left hemisphere. CN3 is dealing with oculomotor. The next couple nerves really deal with eye movement. Because we're such visual creatures, we have a lot of muscles and nerves committed to moving our eyes. We also are very communicative species, so we actually have a lot of nerves going to our tongue as well. So it's easier to kind of lump these guys into categories when you just kind of think about what are the main functions that they are serving. So specifically, the oculomotor nerve, as you might guess, is going to facilitate movement of the eye via the muscles that are associated with the eye. And one of the things to note, if you look at the foramina, in this case, it's a superior orbital fissure, right? So those holes that those nerves are passing for, that's on the sphenoid, right? That's right below the greater wing of the sphenoid. You can actually see that in there, this big kind of open structure. Well, now we know what nerve is passing through it. Okay, the trochlear nerve, another nerve that's passing through the superior orbital fissure, and again, we're dealing with eye movement. So the trochlear nerve, CN4, again, dealing with eye movement. The trigeminal nerve is interesting in that it has 3 branches associated with it, and they're going to 3 different parts of the face, right? And so again, you're dealing with sensory information around the face, and also some of those muscles that are associated with chewing. And if you look at the foramina that it's passing through, you see the foramen rotundum, the foramen ovale. These are structures that we learned again on the sphenoid, so it's all starting to kind of come back together. The abducens nerve, CN6, we're back to a nerve that's passing through the superior orbital fissure, and this one is again dealing with eye movement. Facial nerve, CN7, this is one that kind of passes through a couple spots. One is the internal auditory meatus, or internal acoustic meatus, it's labeled here, and the other one is kind of the stylomastoid foramen. So areas that are kind of, depending on which way they're oriented, they're going to be dealing with different things. So the facial nerve, as you might have guessed, is providing the ability for facial expressions, also a sense of taste on the anterior 2/3 of the tongue. All right, and the other thing with the facial nerve that I failed to mention was you ever heard of Bell's palsy? That's something that you see when people wake up and they have facial paralysis, and it's usually only temporary because it's dealing with some sort of inflammation of the nerve or some of the muscles around the nerve that are pinching down on that and restricting function, and that allows in most cases, Bell's palsy is temporary. So CN8 is the vestibulocochlear nerve, as you might have guessed by breaking that word down, vestibular and cochlea. So this is going to be dealing with a sense of balance and hearing. The cochlea obviously is hearing. The vestibular system, which we'll talk about in a few weeks, is dealing with sense of balance. And again, this is another one that goes through that big hole, that internal auditory meatus. Right, so if you remember that structure on the temporal bone, that's the one that's kind of forming portions, or is associated at least with the ear canal. The Glossopharyngeal nerve is CN9. This is going through the jugular foramen, and we're going to see a bunch of nerves that pass through the same foramen. And as you might guess, it's going through the jugular foramen in the throat. It's going to provide control over some sensations in the back third of the tongue, also with swallowing, and it also is involved in some control of blood pressure and breathing. The vagus nerve, CN10, is one that again passes through the jugular foramen, and it gets the name vagus because it's like a vagrant, or like a little happy wanderer, and it's wandering all over your body to different organs. So it's really interesting in the sense that it goes to your lungs and your heart and your stomach, and also into your throat. So it provides kind of wide range of functions depending on what portion you're particularly interested in. So, in a nutshell, it's going to help with swallowing and speech, but also with the regulation of your guts and parasympathetic nervous system. CN11 is the accessory nerve, another one that's passing through the jugular foramen, and again, this is going to provide, allow you to swallow and move your head back and forth. The hypoglossal nerve, this is one that's again providing help with swallowing and chewing, but it's also mostly involved with tongue movements. And interestingly enough, compared to the other nerves we talked to, it doesn't go through the jugular foramen. It actually passes through a structure called the hypoglossal canal. So there are a bunch of guides out there when you are, feel free to search the internet for them. But what I want you to do again is ID these structures, be able to identify them on sight from an image. Also, really importantly, from the dissections when we get to those. And you should be able to give a couple word function definition. So you should be able to go through the region of the brains, give me a function, the lobes, function, the medulla oblongata, at least a function. And when you get to the cranial nerves, you should be able to go off an image shown right there and give me, identify the structure or identify the nerve and give me the function of that nerve. And your textbook actually has a much better image than the lab manual. So I would use your textbook, particularly for when you're drawing the cranial nerves, as your guide. All right? And so I'll post some of these guides that I found on BB Learn. We'll also post the dissection guide, which is pretty helpful in walking your way through the sheep dissections. And also it ends up being a good study guide as well.